Hi everyone, Dr. Jamie here. So today I want to talk about epidemiology and isms. So epidemiology is the spread of disease through a population, and by isms I mean racism, sexism, classism. So when epidemiology and isms mix, it often has disastrous results. And if this sounds a little familiar, it's because we're living through an epidemic, a pandemic, that is often being filtered through the lens of racism and classism and ableism. But sometimes it's easier to talk about these things when we take a step back and give ourselves historical distance and look at another case that happened in the past. And that's what I want to do today. So previously, I gave a lecture about anti-VD propaganda during World War II. So VD is an old-fashioned term. It stands for venereal disease, or what we would now call STIs, sexually transmitted infections. VD is perennially a big concern of armies when they're going to war. VD costs a lot of lost manpower. It costs a fair amount of lives. I'll have some facts and figures for you about that in a second. But first, I want to refresh your memory, or if you haven't had a chance to see the other lecture, to introduce you to some key figures. So this is the lecture that I used previously, and I just want to take you through two slides of this really quickly. So first of all, if you did watch my last lecture, I told you to watch out for this guy, Surgeon General Thomas Peren, and then I got so excited talking about the anti-VD propaganda that I didn't bring it back to him, which happens sometimes because I'm a nerd. I get excited talking about this stuff, and I get carried away on one tangent instead of another. So today we're going to talk about Surgeon General Thomas Peren. Thomas Peren was the Surgeon General of the United States from 1936 to 1948. He was a really accomplished physician. It's important to understand that before World War II and during World War II, we didn't have the Center for Disease Control. And a lot of what the Center for Disease Control now does in terms of directing public health resources or advising legislators on health policy was handled through the Office of the Surgeon General. So while you may not know who the Surgeon General is or what he looks like, previous to World War II, the Surgeon General was an important government figure, and they had a lot more power than the Surgeon General does today. And in particular, Thomas Peren was a very powerful Surgeon General. He testified before Congress a lot. He was kind of a beloved figure. He was a mover and a shaker. One of the passions that Thomas Peren had was taking VD, or what we would now call STIs, out of the realm of a moral failing and into the realm of public health. And so what I mean by that is that for most of the 19th and early 20th century, if you contracted venereal disease, it was seen as a moral failing on your part. It was very stigmatized and very shameful, and there's still some of that today, but it's far less than it was. So Thomas Peren argued that treating venereal disease like a moral failing discouraged people from getting help, which enabled VD to spread through a population. And so he said that we shouldn't treat it as a moral issue, but we should treat it as a health issue, like a cold. So there are definitely some modern parallels to this. For instance, I live in an area that just recently got a needle exchange program for intravenous drug users. And all of the public health data says that people who use intravenous drugs are going to use them. And the best thing that we can do is kind of minimize the damage to them and our community by making sure they have a safe place to discard needles, by making sure they're not reusing needles or using dirty needles. Because if we don't give them clean needles and a safe place to discard used needles, they're still going to use, there's just going to be more collateral damage. So that whole debate around the needle exchange is very similar to the debate around VD in the time of Thomas Peren. So there were kind of two medical ethics or medical public ethics related to venereal disease. One was people should just have more willpower and not have sex if they don't want to deal with the consequences. And the other was people are going to have sex, and we should reduce the collateral damage to our communities by making sure that they can talk to their doctors about it, that it's not stigmatized, that they can get help if they need it, that they know what signs to look for, etc. So a lot of that can be credited to Thomas Peren, who made it kind of part of his lifelong mission to bring VD out of the realm of moral failing and into the realm of public health. So he didn't always do that in good ways, and we're going to talk about some of that. But he's incredibly important for talking about early responses to epidemiology in the modern US, and particularly for today's discussion of looking at VD as epidemiology. So the other thing I want to bring your attention to is this graph that we looked at this last time. So this was a graph used in congressional testimony by Dr. Bun Danson, who was the chair of the Chicago Board of Public Health. And he had received some federal grant money to implement a program to curb the spread of syphilis through Chicago. And so he was testifying before Congress on how well this program had worked and arguing that Congress should appropriate funds for the VD Act of 1938, which would allow every state to receive federal funds to implement a program like Chicago. So what I want to draw your attention to here is that these numbers by each figure are their ages. And so in this graph, Bun Danson labels the source of infection as a 13-year-old girl. And in his congressional testimony, he talks about how she had a syphilitic canker. And the only reason I bring that up to you is because a syphilitic canker is the first stage of the disease. And so when someone comes in with a canker, what that means is that they recently contracted the disease from someone else. And so with epidemiology, it can be difficult, right, to go further back. We know she got the disease from someone, and the person she got it from probably passed it to several other people. Like she had sex with 3 people who contracted syphilis, and then they had sex with other people. So the start of an epidemic is always in some sense debated or artificial, because you could go back and back and back. But I do think it's interesting that Bun Danson chose to label a 13-year-old girl as the start of infection. And he says this really interesting thing in his congressional testimony. He says that because of the funds that Thomas Peren had given him, he was able to curb the spread of syphilis in Chicago and follow up on the 32 cases of syphilis that this 13-year-old girl left in her wake. And that's a really interesting rhetorical move, because what he does there is he lays the blame for all of this graph on this one girl. While I very much doubt that she was making each of her previous partners, each of her next partners have sex with other people and spread it through the community. And yet in that rhetorical phrasing that she left 32 cases of syphilis in her wake, somehow it all comes to rest on her. And the reason I bring this up is because the treatment of VD in World War II was incredibly sexist and often very, very classist and pretty racist. So that's all I want to share with you about that, just as kind of a lens for what we're going to be talking about today. So I want to go back to Thomas Peren. Like I said, Thomas Peren's life work was reducing the spread of VD by making it something that people felt comfortable talking about with their doctors and taking it out of the realm of being a moral failing or something you should feel shame for. And part of that is that he wrote a book called Syphilis, Shadow on the Land. I always hear it in that old-timey kind of radio announcer's voice. I don't know why. So he wrote this book, Syphilis, Shadow on the Land, and it's very interesting. He takes pieces of the population and breaks them up and does a chapter devoted to each of them. And I'm not making this up, guys. But in his book, he has a chapter devoted to men in the military and to single women, and they're back to back. And what's really fascinating about that is that the way he recommends handling syphilis, which is the same disease, on differently sexed and gendered bodies is completely different. So previous to the start of World War II, there were a lot of restrictions on VD and serving in the armed forces. So if you had VD, you couldn't enlist. If you enlisted and you contracted VD, you were considered wounded outside the line of duty, and the time it took to treat you was added on to your enlistment. And so at the time that Thomas Peren is writing, they had early antibiotics that took about 3 weeks to work. Sometimes your first go wouldn't work, so you'd have to do a second round of antibiotics. So we're looking at 3 to 6 weeks of not getting paid and then having that additional time tacked onto your enlistment at the end. And that's kind of a heavy monetary social burden. In addition, if you got VD while you were in the armed forces, you were sent to a special VD clinic or hospital. And so that kind of goes into that stigma of everyone would know because you weren't treated in the regular hospital. So they would kind of know that you had VD. And again, because it was often seen as a moral failing or something to be ashamed of, rather than just a disease that's passed between bodies, kind of like a cold. Peren argued that all of these things made it less likely that men in the army would report that they had VD because they were facing all of these severe social penalties. So they were risking being ostracized when they went to the VD ward, and then they came back to their unit. They were going without almost a month's worth of pay, and they were having almost a month's worth of service added to their enlistment. And, you know, if you are making a wage and you have to quarantine yourself for several weeks or can't go to work for several weeks and you're looking at losing that pay, you have to make a really serious decision about putting food on the table versus putting other people at risk. And if that sounds familiar to these strange times that we're living in, it should, because we're asking a lot of people to make that decision with COVID-19 as well. And in some cases, we're not even allowing them to make that decision. So Peren recognized that this was a bad system that essentially punished people for getting a certain type of disease, which is weird, right? Like, we wouldn't punish people for getting a cold. We wouldn't punish people for getting a flu. We wouldn't punish people for any other type of disease that's just passed between bodies that have contact. But they were being punished for venereal disease. And Peren said this stops people from reporting, it stops people from getting the help that they need, and it increases the spread of VD. So he argued that Congress and the military should work together to reduce all of these penalties so that people who had VD could enlist in the armed forces, so that people who were in the armed forces and contracted VD could be treated in the regular hospital so that no one would have to know they had VD, but they would continue to get paid so they wouldn't have to choose between giving up their pay or putting other people at risk, and that their time for treatment wouldn't be added on to the end of their service. And it worked. It passed. The military, the armed forces made those changes for men during World War II, all of them. So there's a lesson there, right? About if you want to decrease the spread of disease, you need to make sure that people have the ability to stay home and take care of themselves. But I digress. Interestingly, what Peren recommended for single women who contracted venereal disease was literally the exact opposite. So Peren suggested that women who contracted venereal disease should be put in quarantine camps. So taken away from their jobs, their families, and put in a special hospital they couldn't leave, where they would be treated for VD, and that they should stay there until their treatment was complete and the VD was gone. So if that took 3 weeks, it took 3 weeks. If it took 6 weeks, it took 6 weeks. And at these quarantine hospitals, there were lots of different ones. So some doctors argued that the women at these quarantine hospitals should be forced to do war work, like rolling bandages or putting together first aid kits or other things that would help the war effort. Other folks argued that women at these quarantine hospitals were often working class. We'll come back to that in a minute. And had contracted VD because they had traded sexual favors for food or lodging, etc. And so they should be given working skills. So some of these quarantine hospitals trained women for different professions like seamstress or typist. Regardless, if that sounds a little bit to you like prison, it should. In fact, there's a video I'll try to link to in the description of this one that's kind of an old newsreel about these quarantine hospitals. And I can't make this shit up. The first words out of the narrator's mouth are something like, "It's not a prison." And as a general rule in life, anytime someone tells you it's definitely not a prison, it's a prison. So these women were rounded up from their lives and put in these quarantine hospitals, which is, again, the exact opposite that we see from men. Whereas Thomas Peren was arguing that men should have more free movement, they should continue to keep their pay, continue to go about their normal lives, to encourage them to report VD by getting rid of the stigma and ending these kind of social and monetary penalties for reporting. He was doing the exact opposite to women. So in the early days of World War II, the United States passed a law called the 8 Points Agreement. And the 8 Points Agreement, among other things, allowed any, the highest ranking officer at an Army or naval base, if he thought that a suspicious woman had been standing near the base for too long, he could call and have her arrested on charges of prostitution, which is a heap of bullshit. But anyways, so Marilyn Haggerty is a historian who has a great book that's about women's sexuality in World War II called, I think it's called Kakiwaki's Good Time Girls and Patriotutes. It might be Kakiwaki's Victory Girls and Patriotutes. It's the only thing that's going to come up if you search Kakiwakis on Amazon. It's amazing. And she talks about how there are cases of women who are just waiting for the bus to go to their war job, and someone thought they'd been standing there for too long, and they were arrested on suspicion of prostitution, and they were tested for VD, and they were found to have VD, and they were ripped from their lives and sent to these quarantine hospitals. And I know that a lot of us are having a hard time working from home or going to school from home right now, but the benefit that we have is that we largely have our normal lives. You know, we're in familiar spaces. I'm in my house. You can see my kitchen behind me. I'm comfortable here. All my stuff is here. I can talk to my friends on the phone or through video conferencing whenever I want. I can eat what I want. I have Netflix. Even though this isn't anyone's ideal situation, we have a lot of comforts that I think maybe, I'm not going to say we take for granted, but it's hard to imagine what that experience of quarantine hospital would be like, because it would be so completely different from this kind of voluntary quarantine or semi-voluntary quarantine that so many of us are in right now. Sorry, I had to pause because my brother ordered some gluten-free cupcakes for me for his birthday party, which was supposed to be today, but now we can't have it. So he literally just dropped off these beautiful cupcakes for me. Oh my God, I'm gonna eat all of them. They smell so good. Not all at once, Jesus. So obviously, like, my self-isolation is going very bougie and has nothing in common with a quarantine hospital. So I'm just so excited about these cupcakes. I don't remember where I was. These women were kind of ripped from their lives and sent to quarantine hospitals, and it really was disproportionately working class women, because middle class women often had the luxury of going to private doctors and getting tested for VD and getting treated quietly. Middle class women maybe a little less likely to take public transportation and be waiting. And, you know, a lot of what we think a suspicious person looks like is really based on these racist and classist tropes, right? So even if there's two women waiting for the same bus around the same time of day, you know, if one of them is visibly a little bit more working class, that's probably going to be the one that people call a suspicious character. So the women who were rounded up under the 8 Points Agreement and sent to these quarantine hospitals were largely working class. The breakdown of race seems to be a little more white women than women of color. And the reason that we know that is because, among other things that were done to these women, they were used, the quarantine hospitals were places to try out new anti-VD drugs. So they were used in medical studies. Which were written up in the journal and published in the Journal of the American medical association. So you can read the medical studies about the Arkansas quarantine hospital and how many patients they saw, and how many responded to this drug. And they're wild because this was a time in medicine when it was very, they just kind of assumed that like Black people and white people had different bodies. And they were just like, oh, this drug works better on Black people. And I was like, that, mm, mm. So that's some of the ways that epidemiology and ism combined in World War II and the spread of VD. And really, a lot of our understanding of modern epidemiology comes out of efforts to combat the spread of VD through populations. In fact, the origins of the CDC, so these quarantine hospitals were set up New York, Arkansas, kind of all over, more on the East Coast, to fight the scourge of VD. In part because penicillin wasn't able to be mass produced until the end of World War II. And so penicillin was one of those inventions that just kind of changed everything in a way where you can't remember or really imagine what life was like before it. Like the internet or electricity, it's just so hard to think of how our lives would be without that thing. And so much of the way that culture was changed when that thing became publicly accessible that we really can't imagine. And so an important feature of that is that all through World War II, the government had kind of been preparing, okay, after the war is over, we're going to turn our manufacturing and scientific apparatus towards studying venereal disease so that we can come up with, the elusive thing has always been a cure for all types of VD, so that we can understand how it spreads, we can cure it, we can kind of, work to eradicate it from our population. So that was what they were set up to do. And then near the end of World War II, penicillin became available to the masses. It was manufactured at a large scale, and it took care of syphilis and gonorrhea and chlamydia and these venereal diseases that were the biggest concern at the time. And it was this huge shift. And so then there was this moment of the government kind of being like, we set up these quarantine hospitals, and we have all of these trained medical experts who are going to study the spread of VD. What else can they do? And that, although there are some tricks and turns in the middle, is essentially how the CDC was founded. A lot of the doctors and nurses who worked at the quarantine hospitals went on to work at the CDC when it was founded, because they switched from looking at VD, which is a specific type of epidemiology or spread of disease, to looking at epidemiology more generally. And I think that that's worth noting and remembering, that a lot of the early workers from the CDC came from these quarantine hospitals that essentially punished women, disproportionately working class and women of color, for the same behavior that the Surgeon General was saying men shouldn't be punished for. And so that's an example of the deep, deep, deep connectedness of isms and epidemiology in the United States. And so I wanted to do this lecture today because we are living through a pandemic, and because the Trump administration is trying so desperately to turn this into a racialized thing. So they're approaching this certainly through the lens of racism in terms of calling it the Chinese virus or some other epithets they have for it that I won't mention here. I would argue they're also approaching it through the lens of classism, certainly, in terms of the trillions of dollars we've pumped into the stock market to help big businesses, that is not going to help most Americans. Most middle class or working class Americans are not going to get the help they need through this time. You know, there's classism in the fact that the people who keep society running are janitors, are garbage men, are retail workers, are grocery clerks, often don't make a living wage. I'm not sure there's anywhere in the country right now they make a living wage. And yet they're the ones that we're depending on so, so heavily right now. They're the ones keeping society together, and we can't even thank them with a wage that would support them. What the fuck? So there's a lot of racism and classism in the way that the coronavirus is being approached by the Trump administration, certainly. And I wanted to do this lecture about World War II because, again, like I mentioned at the start, sometimes with that historical distance, we can see a little more clearly how the mixings of isms and epidemiology make a bad combination. And the reason for that is when you approach an epidemic, when you approach a virus or a bacteria through the lens of these human constructs, like race or gender, and then the ism, which attaches a hierarchy to them, right? So in sexism, we have this hierarchy that men are better than women, and that cis folks are better than trans folks, and like whatever the fuck. And of course, racism in the United States, white supremacists. So when you attach this kind of artificial human construct and a hierarchy to that construct to the spread of disease, shit gets fucked up fast. Because disease doesn't care, right? So disease just wants a host, and it wants to do its thing, and it wants to move on, right? Disease just cares about whatever kind of body will be an adequate host for it. It doesn't care if that body is male or female. It doesn't care if that body is in the US or not in the US. It doesn't care if that body is white or black or brown. That's not something that disease concerns itself with. But when you look at a population and say, we're going to curb the spread of this disease by sending women with this disease to quarantine hospitals, the fuck? Where did you think they got it from? Women's bodies don't just magically produce VD and then give it to men like some sort of biological Death Star. No, you're not treating the root of the problem. And the root of the problem is that there's a disease that humans transmit and it needs to be taken care of, right? So when you treat COVID-19 as if it's something that comes from China, and then, as we've seen some cases about in the news, people attacking or verbally threatening people they think are Chinese, first of all, second of all, disease don't care, bitch. The disease is already here, all right? And yelling at someone that you think is Chinese is not going to help. Essentially, when you mix an ism with epidemiology, what happens is you start to focus on other people's bodies. And everything we know about curbing the spread of epidemics is that you have to focus on taking care of your own body. It doesn't do any good to yell at someone because you're a racist fuck about coronavirus, unless you're a racist fuck who also washes your hands and doesn't touch your eyes and mouth. But you're still a racist fuck, and you should check that. So when it comes to stopping the spread of disease or epidemics, all you can ever do is take care of your own body and your own interactions, right? If it's a sexually transmitted disease, make sure to use condoms. Get tested every time you catch a new body. Do the things that you can do to control disease in your own body. That's the only thing that ever works at curbing the spread of epidemics, because you can't control other people's bodies. And when you get focused on controlling other people's bodies, people often take that as a reason to pay less attention to their own actions, and ultimately it winds up furthering the spread of disease. So, if anything, don't be racist, don't be sexist, don't be a fuckface. Wash your hands, don't touch your nose and mouth. I'm gonna get at these cupcakes.